So as a health coach, what I'm doing is we have a system where for our program, once a patient is joined into the program, our nurses coordinate their medication, like if they're diabetic, their insulin titrations and such, while the health coaches sort of deal with all the social barriers. So we help them become enrolled in social programs such as, Medicare, Medicaid, housing referrals, medical transportation services.
One is it's great training for healthcare professionals. So I think it's a great starting point to become a health coach for a year or 2 years. And it really, I think it allows you to build strong relationships without having the medical background. It makes you really rely on your social skills and your communication skills, and it allows you to relate to people, because that's your biggest asset to work with them on their issues, is just being able to relate to them.
We also accompany patients to their doctor's appointments, so we can advocate for the patients, and if the patients sometimes have trouble understanding what the doctor is saying, we basically interpret for them. Also, when the patients complain about certain problems to us but they forgot to mention it at the appointment, or they feel uncomfortable with the specialist or the doctor and they don't want to talk about it, then we advocate for them in that aspect as well and talk about their problems with the doctor.
What our hybrid approach to enhance primary care has been by providing this sort of high touch in the community, in the home, to really understand where the patient is at, how they are taking care of themselves, and then relaying that back to the provider. And so that's sort of been our, and then that's helped to really move the needle on patients' care and helping to improve it dramatically as well. So
I think it's incredible training for anyone who wants to become a healthcare professional, if they want to go on and become a nurse, a doctor, an MA, whatever they want to do. The other aspect is we also have started working with community health workers, and they work very similar to health coaches, but they're typically a lot of them have some medical training, some are medical assistants or that sort of thing, and they're from the community. And in that sense, they're an incredible resource, because they oftentimes will instantly connect with the residents from the community, and in that sense, I think that it's a great career or it's a great retirement opportunity. If you've been working in healthcare for a while and you want to kind of stay involved, and you have a lot of skills and knowledge to offer, but don't want to have as intense a role, I think it's a great opportunity to be involved in the community and work with people through that. So
I've come as a frontline provider of medical care in a community a lot like this, and my passion to be in this is seeing the way that the system is not really working for the health of patients and communities, and wanting to make that better. The area where a lot of interests are aligned is everyone recognizes the terrible problem of the cost of healthcare. And the focus on this particular super utilizer group of patients is where we can align our interests and say we believe we can make it better for the patients, give better care, and it'll be more cost efficient, it'll be less costly if we spend the money on what's really needed.